Hello viewers, welcome back to my channel. Today I will be talking on trial design domain, that is the TE domain, trial elements. In this video, I will be covering many important topics related to trial elements, subject elements, or why there is a no study day zero in the any study, and most importantly, difference between epoch and element. So make sure you watch the full video. The trial element dataset contains the definition of the elements that appear in the trial arm dataset. Any element may appear multiple times in the TA table, but it appears either in one arm or multiple times within an arm or both. However, an element will appear only once in the TE table. The most widely asked question in TE domain is the difference between element and epoch. We will cover this concept in details in few minutes. The structure of TE domain is one record per planned element. The topic variable for this domain is the etcd, that is the element code. The required variables for this domain is the study ID, domain, etcd, element, and the TESTRL, that is the trial element start rule. There are no expected variables in this domain. There are two permissible variables, which are the trial element end rule and the trial element duration, that is TEDUR. Now let's understand the hierarchy in clinical trials, that is from epoch to time point. Every study design in a clinical trial can be broken down to 5 broad hierarchy levels. These are epoch, period, element, visit, and time point. Epoch is the large block of study time, that is screening, treatment, or follow-up. The period is the segment within an epoch, often tied to treatments like period 1, 2, 3 in a crossover study. Element is the smallest unit, usually tied to a smaller activity or treatment plan. Visit is the scheduled site visits where procedure or assessments are done. The time points are the exact time points within a visit, like the pre-dose, 1 hour post-dose, and so on. Now let's see how they relate. Right now I'm showing you an example of a study design of a study where you can see that the you have a distinct information on what is epoch, period, element, visit name, and the time point. Normally in the study, what you will get is the study design schedule. So in that study design schedule, you will see the columns which are highlighted in blue. What these are, that they will give you the information of the visits that will be happening in the study, and which modules, when I say modules, like which assessments will be done in these visits. So there will be many rows having the information of the assessment or the modules which needs to be done, and a cross sign will be marked under a particular visits, that on these visits the assessment will be done. So we normally mention this table as the visit schedule or the study design schedule. So let's see in this example of the study what was the case and how we can understand the hierarchy of the clinical trials from epoch to time point in this study. You can see that from the information what we will get from protocol is that the visit name row, that is, there will be a screening visit, there will be a randomization visit, and there will be 6 cycle 1 week up to week 6 visit, and then there will be another cycles for a different period. Then there will be a washout period, which is marking the end of treatment, and there will be a follow-up period, which is again segregated into two distinct parts, that is 30-day safety follow-up and a long-term follow-up, which is of 12 weeks. So here in this study you can see that The screening visit is again distinguished into weeks or days, and we can see that screening is from week -4 to 2, or you can, in other words, if we categorize in days, it will be -28 to -14. And the same way we have defined the weeks and days for all the visits from each and every cycle period. And if we go further down to the time point section, that is that after visit we have the time point, we will see that in this study there are two time points, that is pre-dose and post-dose, but the pre-dose is happening for screening drug A, cycle 1 week 1 visit, and the second cycle with week 1. So, and post dose is also happening along with pre dose for cycle 1 week 1 and the cycle 2 week 1 here. Now let's understand how we categorize this information into element, periods, and epoch level. You can see that the visit num, which is the screening and randomization, these are part of the screening element. That is that all the screening assessment before the start of the trial, which is the randomization, is considered under the screening element. And the cycle 1, when the randomization happens, that the subject is exposed to the study drug, after that all the cycle visits are categorized under elements as drug A or drug B. How is it that way? So what is happening in this study is that when the subject is randomized, it will be randomized and will be getting a drug A. I'm not mentioning the drug here, and I'm just mentioning a dummy value for the drug is that drug A will be given to the subject at randomization, which is marking the start of the cycle 1 week 1. And this drug will be administered every week till week 16 of cycle, so week 6 of cycle 1. So that's why all the visit, which is from cycle 1 week 1 to cycle 1 week 6, is having the element as drug A, that is that subject is undergoing the treatment using the drug A. So similarly, after the end of the cycle 1 week 6 and the start of the cycle 2 till cycle 6, and we are having the visits week 1 and week 3 and week 5, there will be no assessments on week 2, week 4, and week 6 of cycle 2 to 6. So that's why we only have the 3 visits defined in the visit schedule, that is for cycle 2 to 6. The week 1, week 3, and week 5 will be there, in which the drug B will be administered. So for this duration, the element will be drug B. Then there will be a washout period where which will be marked as the end of treatment, and we will see that the dose of the drug is washed out from the system. So we have given that time, we have defined that element as the washout element in this case. Then it will mark at the start of follow-up, which is start first it will be a 30-day safety follow-up, then there will be a long-term follow-up which will last till 12 weeks. So both these visits comes under the follow-up element. So you can see that in this way what we have done is we have categorized the visit num into screening drug A, drug B, washout, and follow-up elements here. Now talking about the how we can see what these periods are with the understanding of the element. So from the element screening, we can easily say, as the name suggests, that this period can be categorized as the screening period. And the drug A and drug B, we can mention as the treatment period for cycle 1 and treatment period for cycle 2 to 6. Similarly, the washout period can be given as the end of treatment, because we are not giving any treatment there and we are just analyzing the subjects here. And the follow-up will be given as the post-treatment follow-up, or even you can mention as a follow-up period here also. But for this study, it was mentioned as the post-treatment follow-up. Then in the epoch level, if we want to go till the epoch level, again, there will be further uh, cat you can categorize, we can give a epoch for this periods is in this way, that the period screening can be categorized as the epoch screening, and the treatment period cycle 1 and treatment period cycle 2 to 6 can be classified under the treatment epoch, and similar the follow-up period can be classified under the follow-up epoch. So what you can see here is that in this study, mainly we have three epochs, that is screening, treatment, and follow-up. But based on these epochs, you can see that it can be further classified into periods. And if you see here in this study, in under the treatment epoch, we have multiple periods. That is, you might understand as period 1, 2, and 3. So here the period 1 is the cycle 1 treatment period, and period 2 is the cycle 2 to 6 treatment period. Again, the period can further be classified under the elements. And although in this study, in under the treatment period 1, we are only giving the subject as only single drug, that is the drug A, but in many studies we might be giving more than one drug. So or both those drugs will mark as an element for period 1, and same can be the case for period 2, so that you can segregate the periods into elements according to your study. And then the elements will give you the information that when this element was planned, that is in which visit this element was planned. So you can come up from element, you can come up with the visit information, and from visit information you can go to the time points here. In clinical trials, elements and epoch are both terms used to define time periods within a study, specifically when creating the trial design domains. But they represent different details, their different level of details. The element is the smallest planned unit of time in a trial where subject receive a specific intervention or a particular follow a particular schedule. Each element has a defined start and end date, and the subject experiences it in a sequence. Like in this case, it is screening, drug A, drug B, washout, and follow up. Or normally, what we have is screening, washout, treatment, and follow up. Whereas the epoch is a broader time period in the trial and can be used to group multiple elements. As you can see in this case, specifically if you see the treatment epoch, you can see that the element drug A and drug B are coming under the treatment epoch. So they are grouping these two elements under the treatment epoch. Epochs are often aligned with the study's major phases. That is, like pre-treatment, treatment, or post-treatment, or follow-up. So here also you can see we have done so in this study. In a layman language, if you want to understand the difference between epoch and element, you can think it in a way that an epoch is like a chapter and element are the paragraphs inside that chapter. Another relationship which you can understand between epoch and element is that an epoch contains one or more elements. Elements are sequential and specific, whereas epochs provide higher level categorization. Let's talk about the TE assumptions now. There is no gap between elements. Each one begins immediately as the previous one ends. The transition is seamless with no time spent in between. It's similar to how we move from one day to the next. There is no definable gap between the end of one day and the start of another. So, why this matters? That there is no gap between the elements. It ensures a clear and uninterrupted timelines of the subject's experience in the trial. Another most important is that when mapping this in SDTM trial elements or the subject elements domain, you will see that the element start date, which is the SE start date and the end date have a relationship here. What this it is the relationship is that the SEN date of one element is the same of the start date of the next. Why that is? Again, because there is no gap in between. When working with clinical trial data, especially in SDTM, you might wonder why we go from day -1 straight to day 1, why there is no day 0. That also have a logic because of the this concept that there is no gap in between the elements. Let's break it down. There are no gaps between elements in a clinical timeline. The moment one element ends, the next begins immediately. There is no such thing as in between time. At midnight, one day ends and the next begins. There is no pause between them. Can't define a gap between, say, April 21st and April 22nd. The same logic applies to clinical trial days. Because day one begins at the exact moment of the reference event, such as dosing, time doesn't stand still at that moment. So we don't have a day 0. At the moment the screening period ends, that is, if the screening period is from the duration -28 days to -1 day, and the the moment it ends, we start and the randomization was done, that is the dosing starts, it marks as the start of your treatment period. So we do not have day 0, and the start of the treatment is defined as day 1. Treatment start rule should be expressed without referring to arm. If the element appears in more than one arm in the TA dataset, then the element description must not be to any arm. Similarly, the treatment start rule should be expressed without referring to epoch. If the element appears in more than one epoch in this TA dataset, then the element description must not refer to any epoch. Both this concept we will see with an example in few minutes. At least one of treatment end rule, the trial element end rule and the T duration must be populated. Both may be populated. Elements that have different start and end rule are different elements and must have different values of element and element code. Let's see the example where we were talking about that the Tri trial element start rule should be independent of your arm and the epoch. So here I'm showing you the example where we have a TA dataset, and in this TA dataset you can see there are three arms, that is arm code P, A and B. The P arm code is for placebo, arm code A is for A, and arm code B is for B. You can see in all these three arms you have a screening element as same, and we have a run-in element also in all these um, arms. The only difference between these three arms is that the third order of this arm is either placebo drug or drug A or drug B. That is, there is a difference between the treatment epoch only. So if you understand this, that here when the subject is randomized to say placebo arm, the subject will undergo screening and in run-in. When it is in running period, it will be randomized to placebo, and the next element for that subject will be the administration of placebo drug, which will be the marker, which will be categorized as the treatment epoch. Here, you can see if you go to the trial element of this, the unique elements for which this study are the screening, run-in, placebo, drug A, and drug B. Here, if you try to see the treatment element start rule, these rules are defined as which is independent of arm and epoch. Let's see the screening and run-in element first. These two elements are the ones which are appearing in all the arms. So as per the rule, these two elements should be independent of arm. The start rule should be independent of arm. So when we defined the rule here for screening, it is we are just mentioning the informed consent. That is that any subject who has marked the informed consent, who has signed the informed consent, that subject is in the screening period irrespective of the arm. Same is the case in the run-in period, that in the run-in period when the subject has been confirmed that it has passed all the eligibility criterias, or the eligibility has been confirmed irrespective of the arm, it will be uh, it will be moving to the next element of their particular assigned arm. Now let's understand how they have to be independent of the epoch as well. So here the element P, placebo, drug A or drug B, which are all of these elements are coming under the treatment epoch for the different arm. But when we define the start rule for this element, it has to be independent of epoch as well as arm. So here for placebo, you can see the treatment start rule has been defined as first dose of study drug where drug is placebo. So we are not mentioning that it has to become under the placebo arm, because in the, if we mention that it is defined for the placebo arm, then it will be dependent on arm. But where we are just defining based on the treatment, that when the subject is given the treatment drug placebo, the first dose of that study drug is the start of this particular element. And again, since we are giving the first dose of study drug, that is this, we are defining the start of the treatment epoch. We have nothing, we have not mentioned anything related to the epoch here as well. So make sure when we are defining these rules, they are independent of the epoch and the arm in the trial elements. That's all for today. Thanks for watching. Let me know in comments if you want me to cover any specific topic.